Hi, this is Maureen O'Hara. I'm continuing on with the ortho admission orders, and be sure to date, time, sign, and put your dictation number on page 2. There's 2 pages. Okay, next one is you may need to order an MRI. This is one that I was telling you about. This is called inpatient foot MRI and MRA of the lower extremity. Put in the name of the medicine attending here, put in the unit, your name, your pager number, what the uh, gross diagnosis is, comorbidities, diabetes. Be sure to check all the answers yes or no and fill in the blanks, or it will not be entered in the computer. So the reason is we suspect osteomyelitis unless you have some other reason. Study type, always without contrast to start with. Sometimes the radiologist wants you to do contrast, and we could do that at another time. At Rancho, you can order the forefoot or the hindfoot. The midfoot is attached to the forefoot and it's attached to the hindfoot. So if you want the whole foot, you have to order both. Most things that are in the toes and metatarsals can be visualized with just the forefoot with the midfoot. If it's in the midfoot, you may want to order both. And here's one for right and left. If you were going to order an MRA, you need a reason. Here's a reason, again without contrast. If you're going to order an MRA, which sometimes we do because it shows soft tissue sometimes better, and sometimes it gives us a faster way to see the vasculature, be sure to order the knee to the ankle and the ankle to the toe. So that's 2 views that are going to be captured for us there. Just doing the knee or just doing the ankle does not really give us enough information. Be sure that you are specific with the area that's infected, that somebody's not pregnant, and how much they weigh, and that they're not bigger than 21 inches side to side. And then be sure to check off no for all these things unless they have one of them. If they do, put in the date of the implant. Orthopedic hardware is not necessarily a contraindication. Be sure to check off all these things as well. If the patients have bullets or bullet fragments, then you need to get an x-ray of the area where the bullet is. That way the radiologist can rest assured that it's not going to move in the scanner. And then be sure to date, time, sign, and put your dictation number. They are really picky about this. If you do not fill this out correctly or completely, it will not be ordered. So, and the other thing is if someone else has ordered the MRI for us, like the person who admitted the patient at night, make sure that they ordered it correctly and that they ordered the views that you want. The other thing that you need to do is the foot map, and the MRI will not be scheduled unless you do the foot map. The radiologist has requested that you circle the area of interest. Do not circle the entire foot, just circle where the lesion is. So if it's the right great toe, just circle the right great toe. If it's the forefoot, just circle the forefoot. This is because the tech will cone in on the area of interest that you have indicated. You can also make some comments here, like if there's been some previous amputations, that's helpful for the radiologist. And also the radiologist has requested that you order an x-ray if one has not already been ordered from LAC that we can view in Synapse. Be sure to put this in the order section with the MRI order form that you filled out, or the MRI will not be scheduled. So I'm going to stop here. I'm going to pick up with my next segment.